Hello everyone, today I will be talking about hand foot mouth disease in children. With schools opened up and with preschools, daycares, everything functioning, these cases are increasing. It's a kind of viral infection which spreads very easily from one child to another. It can spread through their droplets. If the child puts a toy in his or her mouth, leaves it down, another child picks it up. So basically through contact, through droplets, it can spread from one child to another. It usually spreads very easily. Usually most of the kids will get some sort of infection by the time they are 5 to 6 years, but because of COVID, because kids have been predominantly indoors, some older kids are also getting this infection this time. So what really happens in hand foot mouth disease? Usually in some children it first starts with some cold, cough, fever, typical viral like symptoms, and then after 1 or 2 days they will develop rashes. Some children will have no fever, cold and cough, and they will directly develop these rashes. So these rashes, as the name suggests, will be present on the hands and the feet of the child. Besides that, they may be present over other areas also, especially the buttocks, the elbows, the knees. These are the common areas where the rashes are. And the child will have oral ulcers. So inside the mouth, especially on the hard palate, the upper part of the mouth, you can see these ulceration like mouth ulcers. You'll see like red spots, you'll see, or some obvious ulcers also may be seen. So it is self-limiting in most of the cases. First 3 days the rashes will increase, then they kind of stabilize, and then they start healing. The child is usually considered contagious for 7 days from onset of the symptoms. So if your child develops a rash today, you cannot send the child to school or daycare for the next 7 days at least. If after 7 days also your child's rashes have not started resolving, then please consult your pediatrician. When can you send the child? There is no specific treatment for it. As I said, it will resolve on its own. But what is important is to keep the child comfortable. Children may become very irritable because of the rashes. Some of them may have itching. So on the rashes, some calamine lotion or some soothing lotion can be applied. You can ask your pediatrician for some antihistamine. Usually they will be prescribing it on their own. The most bothersome part for children is the oral ulcers. The oral ulcers are painful, and while eating they find it difficult and it pains a lot. So the most problematic part of hand foot mouth disease is the child's oral intake will go down. So best is to give the child more liquids. Don't be worried if they are not taking solids. Even if you're giving solids, make them very soft, like how you give to babies. That kind of soft you make, and avoid strictly no spicy food and less salt also, so that the ulcers do not hurt so much. Some oral ulcer gel can be prescribed to the child, so you can apply that before giving food to the child, and some multivitamins to help in healing of these lesions. But essentially it is a self-limiting condition, nothing to worry. But rarely in some children the child may not eat at all. The child just refuses to take even liquids. In that case, which is very rare, the child may require hospitalization for 1 or 2 days to receive some IV fluids. So if you notice some lesions or some rashes in your child, especially on the hands and feet, do consult your pediatrician for the possibility of hand foot mouth disease.